Meteorology and health? I haven't got time in my broadcast, you may think. Or, that's the health reporter's job. But you are more qualified to offer this information than you may think. Consider this. The public perceives you not just as the station's weather expert, but also as the station's science expert. Focus group research by the Centers for Disease Control and Prevention has found that, during disasters, people seeking to understand what is happening are likely to pay attention to weathercasters because they view them as credible resources for science information, including health. There's another dimension to your health credibility. Yours is often the most familiar face on your station. In the past, you helped viewers steer clear of a dangerous storm, seek protection, or perhaps even think about energy conservation. Your ability to reach into their homes and befriend them makes your viewers open to hearing your advice. When extreme events happen, the public needs to hear a consistent message from sources they trust. And in many cases, that trusted source is you. Polls indicate that viewers look to the health reporter for lifestyle and fitness content, but they look to you for protective and life-saving information. Bundling health information into your broadcast can make your audience more likely to hear the information, retain it, and, most importantly, act on it. Drought, air pollution, pollen, dust, mold, thunderstorms, floods, hurricanes, landslides, power outages, ice storms, tornadoes, tsunamis, volcanoes, wildfires, and winter storms can all provide opportunities for health messages. And in many cases, connecting the meteorology to human health is as simple as suggesting viewers avoid the sun at midday or get a flu shot at the start of winter. In short, your status with viewers, familiarity with the local environment, and in-depth knowledge about meteorology put you in the perfect position to present healthcasts, information about how weather will affect viewers' health. Healthcasting has real, measurable power. The UK Met Office's use of these messages effectively reduced emergency room admissions of chronic obstructive pulmonary disease patients during times of poor air quality. Their targeted healthcast also encouraged patients to manage their disease better and saved the nation the equivalent of $120 million in 1 year. Healthcasting is in many ways not much different than the traditional UV or pollen forecasting you may already provide. It is an opportunity to better connect the local environment to your viewers, including both information designed to save lives, as well as everyday health messages that can enhance your audience's health and well-being. Getting started with healthcasting is as simple as picking up the phone. You can contact your state or local health department officials and start building a relationship with them. One of the chief jobs of public health officials is to distribute health advice and information to the public, so they will not only have this information, they will be eager to share it with you. Armed with such information, you can target your healthcast to address the most critical health concerns of your viewing audience. The time to exchange business cards with local public health officials, however, is not when the water is rising or a hurricane is looming. You need to develop these relationships ahead of time. To connect with your local public health team, just call the local or state public health office and ask for the public information or relations officer. Explain that you'd like to collaborate with them on communications for weather-related ongoing public health issues, weather emergencies, and other times of disaster. These partnerships can save lives and money. They could also increase viewership. If you expect extreme weather, make a quick call to the local health department to plan health-related heat coverage. You will link your viewers to information they may not have and make your broadcast more meaningful. What's wrong with the following statement of advice for a flash flood situation? If you are not outdoors, do not go out unless you have no other option. Do not go out to view areas that may or may not be subject to flooding. If they are flooded, do not attempt to cross them unless you are sure you can make it and you know the water depth is less than 6 inches. This warning statement is full of problems. Although it may not be overly long, it is overly complex. All negative statements should be rephrased as should the qualifier statements. In addition, people should never be advised to cross a flooded area. The following rewrite is much better. Stay away from areas subject to flooding. Never attempt to cross fast-moving floodwater. If it is moving swiftly, even water 6 inches, 15 centimeters, deep can sweep you off your feet. Remember, turn around, don't drown. Once you have health and potentially life-saving information in hand, it's time to take it to the public. But how you present this information is also important. Simplicity, credibility, verifiability, consistency, and speed count. Messages developed by local health agencies may already take the principles of risk communication into account, and you may be able to simply pass those messages along as they are provided. Developing good working relationships in advance will ensure those messages are available to you quickly. You may not have this luxury, however. You may need to work directly from pre-printed resources. In emergency situations when you must communicate health or safety information on your own, there are a few important concepts to keep in mind. Your goal is to help people make important health and safety decisions in times of uncertainty. You need to structure your messages in such a way that people under stress will remember them and know what actions to take. Stressed out people have a hard time remembering and understanding. Reading comprehension drops by several grade levels. Keeping messages simple and of few parts, no more than 2 or 3, will help both of these problems. Also, phrase your messages in positive terms. If you use negative terms, such as don't or avoid, your viewers will be likely to remember that they're not supposed to do something, but may not remember what. So avoid negative verbs. Instead of saying, "Don't drink untreated water," you might say, "Drink only boiled or bottled water." Help people take responsible preventative actions. For example, remind viewers during evacuations that they will need to take medical supplies and information. This includes prescription drugs, insulin kits, medical records, and physician contact information. Also, be aware of special at-risk populations, like seniors or those with asthma, diabetes, epilepsy, Parkinson's, mobility impairments, or the elderly. Some groups may be more at risk during certain weather emergencies, and their needs and instructions may differ from those for the general population. Seniors may need to be warned not to venture out during icy conditions, and those with diabetes should consult their doctors regarding their fluid intake during heat waves.